My journey started in India, where I was born, and did my medical schooling. Since my immigration to the United States, I continued that journey, first in New York City, where I did my residency in pediatrics, and then to Northwestern in Chicago, where I did my fellowships in initially gastroenterology, and then in liver transplant. My first job, my real job, at the age of 32, was in Cincinnati, Ohio, where I worked at the Children's Hospital of Cincinnati, and a wonderful place as well, and learned a lot more along the way. As they say, when you start to practice on your own is when you really learn.
Dr. Kohli came to Children's Hospital as a division chief of pediatric gastroenterology, hepatology, and nutrition in 2016. I met Dr. Kohli for interview, and then his arrival, and then we worked together for this many years.
Coming to CHLA, when I joined as medical director of the liver transplant team, one of the refreshing aspects right away was how Dr. Kohli really wanted me to be at the table and voice my opinions. Everyone knew early on that he was a superstar in the pediatric GI world, that he was going to be the who's who of the future.
Dr. Kohli created a division who is recognized nationally. According to US News and World Report, CHLA GI division is number 6 in the nation, number 1 in California, and number 1 on the West Coast. And that's due to his efforts, his determination, and his ability to not just to have a vision, but formulate it and accomplish it.
When we look back to his early fellowship research, which has become his academic career, his research on NASH, or non-alcoholic steatohepatitis, we knew it was going to make huge impacts, even in his early training years.
Dr. Kohli is creating a unique program, and with ability to network and outreach and involve the community in his vision. I think that's what makes him visionary. So the liver transplant is just the end result, and hopefully in the future we will be able not to do more liver transplants, but to prevent need for liver transplant in children.
We in the lab have discovered a biomarker, and we've patented it, and it's right now trying to be validated in the general community of children, so that we can not have to biopsy children. So our lab looks at bile acid metabolism and bile acid-driven signaling mechanisms for the study of 2 distinct disorders. One are disorders of bile acid metabolism and defects therein, which are rare, but critically important to understand how the liver works. And 2, a much more common disease, which is coming from our obesity pandemic, epidemic, tsunami, whatever you want to call it, of disease of the liver caused by obesity, called obesity-related liver disease or fatty liver disease or NASH or NAFLD. So those 2 things have been the streams of thought that my lab has started to work on back in 2006, 2007. We continue to do so with the support of the National Institutes of Health and other funding agencies.
Dr. Kohli is amazing with his patients. We had several patients in common. We had several patients we went to see together. And it's such a manner, such an ability to put patient at ease.
He just has a calm demeanor. You see how much he cares when he talks to the families in some of the most difficult and stressful situations that we have.
His approach to the patient is just so amazing to watch, and how he conducts the visit with the patient. I have absolutely no doubt that all the patients love him, appreciate him. And it's not just his manners, but also the depth of his knowledge, the confidence he speaks with, also the softness he speaks to the patient.
I think of him as the epitome of an academician who is also a wonderful physician with top-notch bedside manner. I think of him as someone who can lead when there needs to be a leader, can step aside and let his colleagues walk beside him. I think of him as level-headed in times where not everyone can be as level-headed. I think of him as humble.
Besides being a great leader, great doctor, he's just a great human being. He's very soft-spoken, but very eloquent. He's firm and soft. He's a leader and a team player at the same time. And there is nothing more than you can expect or want from your colleague. And that's, I think, what makes your workplace and working with the patient such a great satisfaction. And he creates this enjoyment in the environment to be in.
So the best part of my job at Children's Hospital Los Angeles today is the future. It's not about me, it's not about where I've been, what I've learned, what I'm doing in the lab. I would say even not what I'm doing in the clinic. The best part is what we are creating as future caregivers. Our training programs, the next crop of brilliant minds that are coming through our system. And we have such an amazing opportunity to train the next generation, given the high volume of care that we provide, the high complexity of care that we provide, and the amazing outcomes from those interactions with children that we have for the health of these children. So in 2021, the calendar year that just completed for the 12 months in that year, we did 31 pediatric liver transplants at Children's Hospital Los Angeles. This was the highest number in the state of California and number 2 in the nation. And volumes are important for pediatric liver transplantation. As you can imagine, the more you do, the more the team works together and the more seamless things become. And yes, there are always learnings from each child, but we hope to take those learnings and help the next child as well. So again, very privileged and humbled to be part of that team. So what wakes me up in the morning is the impact that is unseen, how it'll impact people I will never see, how it'll impact the futures of individuals who may not work with me long term after their training is complete. That is a reflection, a laser beam that will be sent out into the future, which I will never have sight on, but will still have impact on. I'm very proud of what we have accomplished within the gastroenterology division, the liver transplant program at Children's Hospital Los Angeles. But I'm really humbled by the potential we still have. I think there's so much more we can do, and there's so much that we have learned from what we have done in the past. So what would be amazing to me is that we continue to learn from our errors, improve on our performances, and grow the impact that we can have on our community and beyond. And it can't happen because of one person. It's because everybody is geared up and looking towards the same vision, and the vision is to serve our community.
I love Dr. Kohli as a colleague, as a friend, as a person, and he has made great contribution to Children's Hospital, to the field of pediatric liver diseases, and we wish him many more years of such a productive and great work and contribution to the field.
And I think of him as well deserving of this recognition by the Liver Health Foundation.
I really appreciate the recognition. However, I do want to say that I feel there are many more people out there who deserve this recognition so much more. But I'm thankful, and I hope that as we grow together, Liver Health Foundation will be able to recognize many such individuals. Thank you so much for the honor.